Doctor says your HbA1c levels are normal, but your blood sugar readings are still high. Confusing, right? But here is the truth. This is not a lab mistake. This is your body playing a trick. HbA1c is meant to measure the average blood sugar over the last 3 months. That is because red blood cells live for about 120 days, and during this period, glucose slowly attaches to the hemoglobin. The more glucose in your blood, the more gets attached. That's what HbA1c measures. Now, here's where the things get interesting. What if your red blood cells don't live that long? If they start dying earlier than normal, they don't get enough time to collect the glucose. So your blood sugar may actually be high, but your HbA1c still appear lower than it should be. This happens in real-life conditions like hemolytic anemia, G6PD deficiency or sickle cell disease, where the red blood cells break down faster. It can also happen after a blood loss, blood transfusion, during pregnancy or in chronic kidney disease. When someone starts a treatment for anemia with vitamin B12, erythropoietin or iron, the bone marrow responds to it by pumping out a surge of reticulocytes, which are actually immature young red blood cells. These cells have spent almost no time in the bloodstream. Because they haven't had the time to become sugar-coated, they dilute a concentration of older glycated hemoglobin. So, as a result, the HbA1c percentage drops, but the patient's blood sugar level may not have changed. Now, imagine the risk. You look at the HbA1c and think everything is under control. But in reality, the blood sugar is still high. That means diabetes can be missed or treatment can be delayed. So in such situations, doctors don't only rely on HbA1c. They use other tools like fructosamine or continuous glucose monitoring to see the real picture. If red blood cells don't live long enough, HbA1c will lie. And when HbA1c lies, diabetes hides.